and I'm going to talk about why you should be registered to donate bone marrow. So maybe you're asking what bone marrow is. Bone marrow is a soft tissue that's found inside long bones, vertebrae, and the pelvic bones of the body. It's consisted of red marrow, which has red and white blood cells, and yellow marrow, which is fat and connective tissue. But when you're born with mainly red bone marrow, and then as you age, the red marrow is replaced by yellow marrow, and by the time you're an adult, it's about half and half. Here's a picture of bone with the marrow. So at the top there's red marrow, and then in the main cavity there's yellow marrow. Okay, so why is it donated? It's donated for patients that are diagnosed with leukemia, lymphoma, and other life-threatening diseases. When they're essential because stem cells have the ability to mature into red blood cells, which carry oxygen to the body, or white blood cells that can fight off infections and diseases, or platelets, which help blood clot and control bleeding. But for patients that have cancer, these functions are disrupted in their system. How is it donated? It's donated through two ways. There's the peripheral blood stem cells, which is PBSC, or bone marrow. So PBSC is a non-surgical procedure. It's done in a blood clinic or in a hospital that does it. And it's similar to donating platelets. So for 5 days before you do your PBSC, you're supposed to take a drug, and that helps increase the number of blood-forming cells, or they're also known as blood stem cells, and it helps increase them in your bloodstream. Also, the day of your procedure, you are hooked up to 2 needles, one in each arm. One needle takes the blood and it puts it into a machine like this. Sorry if you can't see it. It spins the blood and it takes out the stem cells, and it returns your blood into the other arm, so that you're not losing blood, but it's just taking out with ease for your patient that you're donating to. 75% of people that do this procedure it takes up to 8 hours for them. Then the next 25%, they do it in 2 sessions, and the 2 sessions take 4 to 6 hours each. And it just depends on how much they need and if your body can withstand 8 hours. So here's a little diagram. So it comes out of one arm with the stem cells. It takes the stem cells out of your blood, and it puts your blood back into your other arm. So for bone marrow, it is a surgical procedure, and it's done in a hospital operating room. The doctors, you put a dot on your stomach, and you're put out anesthesia, so you don't feel any pain. They use a needle, and they put it in the back of your pelvic bone, and they draw out the liquid marrow for the patient. And it's done right one after the other. You go in, do your procedure, and then they take the marrow straight to the patient and they put the marrow in the patient. And when it comes to recovery, it just depends on how your body reacts, if your body can heal fast, if it takes the pain. Some people feel a lot of discomfort, which is normal because it's a big needle going into your hip. And others feel a ton of pain. Some people feel absolutely no pain. It just all depends on how you are, but most people can return to their activities in 1 to 7 days. So here is another diagram. The patient's laying on their stomach, and a big needle is inserted through the bone, through the skin, into the marrow, and it sucks the marrow out, and then withdraw. And that's it. It's actually not bad. So to actually register, there's a program called Be the Match. And Be the Match is for marrow and cord blood donations. And as of right now, there's 10.5 million people who are on the bone marrow registry at Be the Match. This is just for Be the Match. When you do register, you get a big packet like this, and you have a little insert, and it says your copy, and it contains information such as the PBSC donation, bone marrow donation, so that you know in case you get asked to do it. It includes information that has your name, phone number, contact contact information, and then it has medical evaluations, which include questions such as have you been a blood donor in the past year or so, or would you like to be contacted, anything like that, just to know how you are and if you can do it. Then after that, you're going to get a little cardboard box, and it has places for cotton swabs. There's 4 cotton swabs, and you take one and you swab it in each corner of your mouth. So you do one in the top right, bottom left, top left. And just so that they know, so that they can do research and see what type of donor you are, so that they can be sure that you're the perfect match in case you get asked to actually donate. So once you register, and if you get asked, here's the laydown. So actually, there's actually a big chance that you won't be asked to donate bone marrow. There's a 1 in 540 chance that you will be asked. So just through Be the Match. And there's a ton of other organizations that do it, so this is just through Be the Match. And so once you're asked, if you say yes, they're going to give you an information packet, such as what is each procedure, where you're going to go if you have to travel out of the state, and for donating, it actually takes about 4 to 6 weeks, which is spread out in 30 to 40 hours. And the 30 to 40 hours can include time traveling out of state, traveling 3 hours, anything like that. And you have to go through steps to actually be able to donate. And the first step is you have to update your health information. The second step is you have to participate in an informational session, which just gives you information on the bone marrow, and then if you're actually going to meet the patient, it just depends on the hospital. The third is you're going to sign a consent form. The fourth step is you're going to have a physical exam, and then the fifth step is you're going to have a couple of blood drawn, just to see that you're actually the perfect match. And then the sixth step is you donate. And that is all. So, thank you all for giving your undivided attention. I hope you all learned a lot from this. And I actually have packets to donate if you want to register. I don't have them with me, but I'll have them on Monday and Wednesday. So if you want to do that. It's an amazing cause, and I really hope that you all can join in. Thank you.